what I'm really interested in is human memory, and our memories guide our future thinking and behavior, and they do that at a personal level and at the level of a collective, so a society, a neighborhood, a country, even. And what I'm worried about is that to the extent that some people and some collectives, some societies or countries emerge relatively unscathed by COVID, I worry that we might see this ironic effect that they're less prepared for the next one. With respect to human memory, contact tracing is really hard. That's not hard simply because there are too few public health officials scrambling after too many contacts, but because trying to get people to remember accurately and completely where they were and who they were with, 5 to 7 days ago when they weren't even really paying attention is hard. It's really hard. Well, it's always been true that the questions we can ask in science, the methods we adopt, and so the research we can do is always limited and shaped by what's possible and what's practical. But when you're in a pandemic, there's so little that is possible and practical. And so the whole landscape of science, psychological science, is being distorted and skewed towards questions and methods that we can do online. On a personal level, scientific research is a very social activity. A lot of people don't realize that, but when you say science is a team sport, it's really true. It is exceedingly difficult to create that feeling of team or groupiness when professors are tired and students are tired and you're on a roller coaster where you can't plan from one week to the next. I would be remiss if I didn't talk about a paper I was involved in that came out towards the end of 2020 in Perspectives on Psychological Science with some collaborators, Lorraine Hope, Rachel Zayons, both of whom are psychological scientists, and then two epidemiologists on this paper too, Jamie Robertson and Aisha Verrill, who's now an Associate Minister for Health in the New Zealand government and was particularly instrumental in our internationally very successful contact tracing program. And there, we looked at all the work on contact tracing and said, what's really missing from actual public health versions of contact tracing is a recognition of the failings of human memory. And what we wrote is you should treat contact tracing as though the same way we try and interview witnesses to crimes. And we're not talking about a crime here, but what we're talking about almost like a crime, an event that people can't see, the possible transmission of a virus. Well, infuriatingly, I think the news media has ignored too much of psychological science when it comes to COVID. So if I flip that around, what I would say is, here's what they've not paid attention to about psychological science and what psychological science can tell us about what's happened over the past 2 years with COVID. So for instance, they've done a particularly bad job in not making it clear that as science updates, rules are going to need to update. Right. And understanding that the information that people learned first is going to anchor what they understand later, whether it's true information or false information. So it's really hard for people to update and change their behavior, not explaining what efficacy means with a vaccine, and then just this whole collection of mixed messages and then vacuums that are filled by misinformation. It's not just the news media, of course, but the news media, I think, could have played a much better role at getting us where we needed to be and hasn't.